Bedfont Scientific Limited has put together some advice on how to safely perform breath tests during the pandemic. However, first and foremost, it is recommended that you follow your local guidelines on breath testing procedures and necessary PPE. Patients presenting symptoms should not be tested, and a symptom questionnaire should be completed prior to the appointment. If it's been a while since you used your NObreath, please check the batteries have charge, and you may wish to perform a bump test with certified gas to ensure the device is reading correctly. As standard practice, the external surfaces of the NObreath monitor should be wiped down with the alcohol-free antibacterial wipes provided. We have tested and recommend both Azo and Clinell universal wipes for use on the NObreath FeNO monitors. Turn on the NObreath by pressing the power button and hand the unit to the patient. Bedfont recommends that the patient should unwrap and insert their own mouthpiece and hold the monitor themselves when completing a breath test. When the patient is ready, they can begin the breath test by pressing the breath test icon on screen. As instructed on the monitor, the patient should inhale deeply before slowly exhaling into the NObreath, following the on-screen motivational guide. Bedfont recommends that whilst taking a breath test, the healthcare provider does not stand directly in front of the patient and observe social distancing as per local guidelines. A tick will signify a successful test, and the result will be shown on screen. To minimize cross-infection, it's recommended that the patient disposes of their own mouthpiece in the clinical waste bin. Readings and results can be interpreted using the NObreath FeNO interpretation chart. Once again, wipe the external surfaces of the NObreath FeNO monitor after each patient use.